Hello, everybody, and welcome to today's webinar from the Consortium of Universities for Global Health on the Trainee Advisory Committee and the Campus Representatives Program. It's an informational webinar which will showcase these two exciting programs that we have with students. I'm Dr. Keith Martin. I'm the Executive Director for the Consortium of Universities for Global Health. CUGH is very engaged and active with students around the world, and we have two groups today that are going to tell you about what they do. The Trainee Advisory Committee, and we'll have Priscilla Auguste, who is the chair of the TAC, which it's called, the acronym, and Deepika Khanna, who is the vice chair, the incoming chair-elect. And then it'll be followed up by an informational webinar on our Campus Representatives Program. Sarah Matthews from Tulane University, who's the chair of that program, she'll speak about it, followed by Sebastian Romero, who's the deputy chair of that program. And then finally, we have Dr. Peter Kilmarks. Dr. Kilmarks is the deputy director of the Fogarty International Center at the National Institutes of Health. And they're going to tell you a little bit about what they do. And also, it's really important, I'd like to emphasize that the purpose of this webinar is for it to be shared widely and for us to expand our engagement with students around the world, to learn about what students' needs are, to help to inform CUGH on our activities to support students' needs, and for both the Trainee Advisory Committee and campus representatives around the world to be able to take the work we're doing and mobilize students, and importantly, the public, to address the global health challenges before us. Dr. Kilmarks will talk a little bit about the exciting programs at the Fogarty Center and opportunities for students. And with that, it's my pleasure to turn it over to Priscilla Auguste, the chair of the TAC. Priscilla, over to you.
Thank you, Dr. Martin. I'm so excited to be able to share the opportunities that we have at CUGH for students as well as trainees. And so I'm going to start by talking about the agenda. So if you go to that slide. So essentially, I want to start off by talking about what the Consortium of Universities for Global Health actually is, because I feel like you might be a student who heard about this webinar, maybe from a faculty member, and therefore you don't maybe know who the CUGH is. And so we're going to briefly touch on that. And then after that, we'll talk about the CUGH Trainee Advisory Committee, followed by the Campus Rep Program, and then we'll end by talking about what the connection is between the two programs. So next slide. So the CUGH was started in 2008, and they are a Washington DC-based nonprofit organization with over 170 academic institutions and other organizations from all around the world. And they're all essentially engaged in improving the health of people and the planet. And especially they're focused on improving health outcomes and low-income and outcomes in low-income communities. The mission of CUGH, on the next slide, is to support academic institutions and partners to improve well-being of people and the planet through education, research, service, and advocacy. Next slide. Next slide. So the CUGH vision is to support the university as a transforming force in global health. And as you can see, this is just a snapshot of all of the organizations and institutions that are a part of CUGH. As I mentioned before, it's over 170 member institutions, which I think, in my opinion, is a big deal. And if you want to find out just what that full listing looks like, I have provided a link here at the bottom so that you can actually see the full member list. But it's a really greatly connected network. With that, I'm going to move on to talking more about the CUGH Trainee Advisory Committee, or TAC for short. And so I'm Priscilla, and I'm the current chair for TAC. I'm a fourth year medical student, and I'm actually from the Ross University School of Medicine, which is located in Barbados. Now, the CUGH Trainee Advisory Committee we basically, we're here to support CUGH's mission and provide that student perspective. And that CUGH mission, as we mentioned before, is to improve the well-being of people and the planet through education, research, service, and advocacy. The committee is 25 students, trainees, and young professionals, and we come from around the world. Like currently, the committee consists of students from Ireland, we have students from Ethiopia, Uganda, the US. So we're all coming together to work on addressing global health challenges through various activities. And these issues can be anything from COVID-19, racial disparities and diversity, climate change, gun violence, student debt, so you name it, we're trying to work on it. So the thing that I know that might be on the minds of many of you is, what can you do to be a part of this? So essentially, you just need to be a student, whether you're on site going to getting your education face-to-face or you're online, as many of us are doing right now. And essentially, you're pursuing a degree and are registered at a university and are graduating in no more than 1 year from when your term will actually start. And just be interested in being a part of this global health network and contributing to global health. One of the things that TAC celebrates is ethnic and academic diversity. And so we want pretty much every student to consider the impact that they can have to global health. And it doesn't matter where you came from. As I mentioned before, we come from a lot of different countries. And it doesn't matter what academic background you come from, because I think that there is a place in global health for pretty much every academic background, whether that be medicine, economics, marketing, zoology, law. There's a place for everyone. And so we really encourage everyone to apply. And so the next thing I'm going to talk about then is, what is a trainee? I know this is a term that comes up several times. And so essentially, a trainee is someone who graduated from a university and is in their first year of postgraduate training. And so that could be, for example, medical intern. So I know right now on our TAC committee, we have someone who started off as a fourth year medical student, like me, I'm a fourth year, and then for their second year of TAC, they are a medical intern. So that's completely fine. It's just that for the first year of your term in TAC, you just need to be a student. And so you must also not anticipate, therefore, that you'll need to graduate, you'll be graduating from your institution before your first year is up. So with that, I'm going to actually transition to Deepika, who's going to talk a little bit about the membership requirements for TAC.
Thanks, Priscilla. My name is Deepika. I'm a second-year medical student at the University of Illinois College of Medicine at Chicago. And like Priscilla said, I'm going to be talking a little bit about the requirements and responsibilities of a TAC member. So listed here are some of the requirements in order to become a TAC member, one of which is to be an individual or institutional member of CUGH. So like Priscilla had mentioned earlier, there are over 170 institutions that are members of CUGH. So you can check if your institution that you belong to is a member. If not, you would need to become an individual CUGH member, and that cost varies depending on where you're coming from, but the link to become an individual member is listed here on this slide. And then the time commitment for engaging in the TAC activities while you are a member pretty much varies depending on your level of engagement, but it averages to about 2 to 3 hours per week. So the ability to commit that time. And then the membership for TAC members is 2 full years. So the ability to commit those 2 years. And then just being ready and willing to serve in various leadership positions. You can be called on in various ways, which I will explain further on. And finally, all of the TAC members really come together in person during the annual CUGH conferences. So it's important to be available to both attend and also volunteer in various capacities during those conferences. Some of the responsibilities once you are a TAC member will include attending our monthly TAC meetings. It's all virtual, so every month the 25 of us come together and go over our agenda, discuss the projects that we're working on, and give updates on our various committees that we're serving on. So you would also be an active participant in internal committees within TAC, which I will explain in detail later on. And those committees typically meet around once a month as well, but that can vary depending on which committee you're in. You'll also be on an external committee or a CUGH committee, which I will explain further on as well. And that committee could meet around once a month. And again, this can vary, but with all of those committee meetings, it's important that your attendance is up to 70%. And on top of those meetings, you'll also be working on the projects within TAC, and that will be the time commitment as well. But above all, it's important to just have active communication about your ability to commit this time and attend the required meetings. So like I mentioned before, there are many leadership opportunities that become available once you are on TAC. Some of these include being able to serve as the chair or chair-elect of TAC. So like Priscilla mentioned, she is the chair and I am the chair-elect, which is also the incoming chair. So I will serve as the chair next year for the cohort. And you're also able to serve as the team lead of your internal committee. So you would be leading about 4 to 5 members of TAC in that committee. You can lead your own TAC collaborative project. Priscilla will go over some of the current projects that we are working on. So you can definitely take a leadership role in that. You can lead a project on the committee that you're serving on as well. So it really depends on how much you would like to engage once you are a member. As a TAC chair, as a leader of TAC, you are able to interact with the CUGH Secretariat and the CUGH Board of Directors and really serve as that point of contact with all of them, as well as other organizations and professionals within global health. So like I mentioned before, TAC consists of 5 different internal committees that you will serve on at least one during your time in the committee. These include social media committees that would be in charge of the social media accounts and posting and advertising for our projects and our initiatives. There's the conference planning committee, and you will be planning the satellite and breakout sessions for the annual CUGH conferences, the campus representative committee, and that program will be discussed later on. Sarah and Sebastian will discuss that. There's the research committee, the ability to conduct many research projects within TAC and CUGH, and then the elections and vetting committee, which manages the voting and elections process. So those are the 5 committees within TAC. And then within the CUGH network, there are many committees that CUGH members serve on, and there are a few spots reserved for TAC members to be able to participate in those committees as well. So when I mentioned external committees, this is what I was talking about. So all of these committees, you have the opportunity to serve within them and be able to work with other CUGH members and professionals in those capacities. And I know this might be a lot of information to take in all at once. It can get overwhelming, definitely, but it's important to remember that bottom line, we really understand having that TAC mindset. And we know that we are all students first, and that's something that we have to continually remind each other and recognize, and that always comes first. So we definitely have to keep our limitations in mind and be honest with ourselves and how much time we're able to commit. And it's really, really important that we all openly communicate with one another and are able to just be transparent. And I think that will really help for all of us to have a successful time on TAC. There are many opportunities for building organizational and multitasking skills. And so it's definitely something to consider. But again, we recognize that we are all students first, and we just really appreciate being openly communicative with one another to make sure that, you know, this doesn't become overwhelming, the amount of work or the amount of engagement that's required on the committee. So now I'll pass it over to Priscilla to talk about some of the projects that we are currently working on in TAC.
So I'm just going to briefly go over some of the projects that we're kind of working on. Like I said before, academic and ethnic diversity and global health is very important to us. So we have a campaign set aside for that to try and increase both of those areas. We're also have two advocacy groups, that the underrepresented minorities and the student debt advocacy group, both of which are working to disseminate information about these two issues that I think are very important to students. We're working on a webinar for October. We're working on a commentary. We sent out a publication in the CUGH July 2020 bulletin. And we're also working towards a satellite session as part of the CUGH 2021 conference. Next slide. The other things that we are working on is COVID-19 project, which I think is very important considering the current times. We're also working on trying to make sure we bring together all the information that students tell us about what advocacy issues are important to them. We want to bring that to the CUGH. We're also working on research study to figure out what things are actually get a student interested in global health and the barriers to actually getting involved. And finally, we're working on a gun violence initiative. And essentially what we have here is we worked with CUGH, and now we have the ability to see where our congressmen stand as far as gun control. So you can even scan this QR code right now, and it would bring you to a webpage on the CUGH website that talks about this issue, and it helps you to see the contact information, not even just the listing, but the contact information of all your congressmen and where they stand. So with that, I'm going to turn it back over to Deepika, who's just going to talk about what current and alumni TAC members have said about TAC.
So in order to capture the essence of what it really feels like to be a TAC member, what the experience is like, we collected some quotes and testimonies from current and previous TAC members. So here we have a quote from Priscilla herself, and she commented on how it's really awesome for students from around the world to be able to come together, whether it be virtually or in person at the conference, that we are all able to gather for one purpose and work together as one unit. Another TAC member, Ryan, said that it could literally change your life by opening limitless doors. He really appreciates the opportunities that being within this network has to offer. A couple of the TAC members commented on what they were able to work on and accomplish during their time on TAC. So Derek, who is a current member, was part of the underrepresented minorities in global health advocacy team, and they're hoping to share their findings at the upcoming CUGH conference. Another TAC member, Tommaso, is part of the research study on global health interests and the barriers to global health careers, and he is also heading the campaign that recognizes student efforts and trainee efforts on the COVID-19 response. And then we have another TAC member, Nirmal, who mentioned that he was able to utilize his previous research experience and build on those skills through various research projects and opportunities within TAC. And finally, we collected a couple quotes from previous TAC members. So we have Jessica, who is a TAC alum, who mentioned that after leaving TAC, she actually became a member of CUGH and now serves on a CUGH committee. So she was able to sort of continue that to build on her career and her global health-related goals. And then Tastic, who was the previous TAC chair before Priscilla, really was celebrating and appreciating the inclusivity and the diversity of TAC, where there is no chance of feeling inferior because of any status. So that's something that he appreciates about the Trainee Advisory Committee. And so listed here are some of the frequently asked questions. One of the biggest one is how to become a member of TAC, and we are accepting applications for the upcoming cycle, and that cohort would serve from 2021 to 2023. So that application cycle opens in a couple of weeks, actually, on August 17th, and it will close on September 17th. So there's a window of a month. You can apply at any time during that month. And to find the application link, please follow us on Instagram, Twitter, and Facebook. We'll be sharing more details, which will include the link for the actual application once it opens. And then after that window closes, the applications will be reviewed, and the next cohort of members will be accepted this upcoming fall. And their TAC term will actually begin in March of 2021. So it usually begins during the conference, the CUGH conference, which is in March, and that term will go until March of 2023. So they will be accepted in the fall, and between then and March, when their term actually begins, they will spend that time sort of orienting, going through the handbook, shadowing in the monthly meetings, and just, you know, sort of getting oriented for before their term begins. And the next CUGH conference, like I mentioned, will be March 12th through 14th, and Satellite Day will be on March 11th. So that is all we have for the Trainee Advisory Committee, and here are just all of our members. And I'm going to pass it over to Sarah and Sebastian to discuss the Campus Representatives Program.
Great, thank you so much for that great presentation, Dabika and Priscilla. I will go on to speak about the Campus Representative Program. I am Sarah Matthews. I'm a Master's of Public Health and Epidemiology student at Tulane, and I am the senior lead of the committee. And Sebastian Romero is our junior lead of the committee, who will be speaking after me. Next slide. So before we start, I want to go over the description and the goals of the Campus Representative Program. So we are a network of students who serve as representatives of CUGH on their respective campuses. So to be a part of the Campus Representative Program, as we have mentioned, you do not have to be a part of CUGH itself, but you will be serving as the representative on your campus for CUGH. So your relationship with the relationship between the campus representative and CUGH is that you will be communicating openly with us about your institution and student needs and interests in global health specifically. So we consider this a bilateral relationship for information, and we are considering you the eyes and ears of CUGH. And we additionally want to increase the CUGH and TAC's reach and support to TAC-related projects. So I will go more into that later on, but campus representatives really serve as CUGH advocates on their campuses, and you also provide additional research support for us, which I will go over. Additionally, you'll receive custom resources and guidance from CUGH as a campus representative, and so we develop and curate resources for you all so you can benefit from this network and relationship to the most that you can. Next slide. So some of the benefits of being in the Campus Representative Program is you'll have opportunities to work with us on some volunteer projects. These we are aiming to increase within the upcoming years, and we really want to make sure that you have an opportunity to work with us. We really value your skills and your professional development on the Campus Representative Committee, and so we will be providing you with some opportunities to work with us. Additionally, you serve as an advocate on your campus. You are the main global advocate on your campus for CUGH. So we really rely on you all to spread and disseminate the advocacy messages that CUGH develops and creates. So we would like to share those, so you will be disseminating those within your network. That is a huge benefit. You get to serve in this role. You additionally are the direct liaison between your institution and CUGH. You are the student voice for your institution. So you are the one in charge of collecting student needs and transmitting that message for us so we can work with you and see how we can address your student needs and make sure that you are benefiting from this relationship. Additionally, you are representing your institution in one of the largest global health academic consortiums. So as such, you'll be spotlighted in social media, etc., for your work as a campus representative, as we highly value your experience and time on the committee. You'll additionally have, as I mentioned, access to the CUGH Campus Representative Program curated resources. Additionally, you have free individual membership to CUGH if your institution isn't already a member. So as we ask of you to participate in the responsibilities and requirements of a campus representative, in return, we will give you free membership to CUGH if your institution isn't already a member, and you'll have access to campus representative exclusive networking opportunities. This is a large network, and access to it means you get to communicate with those that you might not have been able to as easily before. Next slide. Now I will go over some newly implemented requirements and eligibility. So we have, if you are already a campus representative, you'll notice that there are a few changes to this, we think that these are going to be really beneficial for you to make the most of your time as a campus representative. So the requirements for the 2020 to 2021 year, as we have really want you to know that these requirements are for just this cycle. These are a work in progress and they are subject to change. So if you have any questions regarding them, please reach out to myself or Sebastian. And so your first requirement is that you will be participating in one CUGH project per recruitment year. We'll go over what these look like, but these are really to benefit you and to let you gain some skills with CUGH, network with TAC, and really just feel like you're contributing to CUGH work. Additionally, you are the advocate of CUGH's for CUGH advocacy projects. As such, we expect you to log your dissemination of these materials at least twice per recruitment year. Additionally, we expect you to communicate with us. You, as a campus representative, you are the eyes and ears on your campuses, so we value and appreciate your open communication. We'll be using the communication platform Slack, providing you with prompts about once a month and we expect you to at least fill out one of these prompts regarding your institutional needs, your interests, what sort of projects you would like to do, and what's going on your campuses. We want to make sure that we have open communication with each other. So to be in the campus representative program, the eligibility requirements are you must be a trainee or student for the next full academic year. So we have some flexibility with this. If you're graduating in May, we understand it will allow you to continue throughout the end of the recruitment cycle, so July 2021. Faculty are accepted into the campus representative program. So if you're a faculty member of your institution, we welcome you into the campus representative program and to serve in this role. So our second point in eligibility requirement is that we ask if you are not the only campus representative on your campus, you are required to collaborate with the other representatives at your institution to achieve your requirements. If there are two representatives, you will only have to fill out the same set of requirements. So one of your representatives will have to participate in a CUGH project per recruitment year, and another will have to log the dissemination of CUGH advocacy materials 2 times per year. It will not be duplicated requirements. Next slide. And so now I will pass it on to Sebastian, to our junior campus representative lead.
Thanks, Sarah. Well, everyone, my name is Sebastian Romero. I am a third-year PhD nursing student at the University of Utah, and I'm happy to be in this webinar today. A couple of things. So in regards to the requirements and benefits, so real life scenario, we just wanted to run a real life scenario by you. So volunteer projects, when we do come up with volunteer opportunities or advocacy issues, we'll send out an email either email or Slack. And then if you do wish to contribute, you can just hop on board and contribute to the project. So that is kind of a volunteer opportunity. But on the flip side, if you just have your own advocacy issues that you're interested in or working in your institution, you can always reach out to us, use the network, ask questions, whichever way we can help, we're happy to do so. So that's kind of the two-way plan we have, where we do wish for you to contribute to the projects, but we also want to contribute to your projects in whatever way we can. So we have 2 specific goals for Campus Rep program. The first one is we do want to increase global representation. Like you can see on the map, there's definitely some clusters of places more represented, and we want to expand and have other countries and institutions and communities represented. So that is one of our goals for this coming year and following. And on the other side, we also want to increase communication with campus reps. So we want to expand campus rep program as well as strengthen it by increased communication. And this is done, like Sarah said, through volunteer projects as well as increased network. So the enrollment for the program has already started. It started August 1st and goes through November 1st. There's 2 surveys in order to sign up for the program. One is continuing campus representative survey, and if you're continuing, if you've been a campus rep, that's the one you want to fill out. And if you want to be a new campus rep for your institution, there's another survey. And there's links on this PowerPoint, as well as through email. You can also find those links. So now I'm going to hand it off to Priscilla, that's going to talk about the two distinctions between TAC and campus reps and how they work together.
Thank you, Sebastian. So I'm just going to quickly run through, because some of these have already been discussed in the beginning parts of whether the TAC section of this webinar or the campus rep section. So next slide. So we've already told you about how the fact that CUGH has a lot of committees that are committing to its overall mission and its goal. One of those committees is the Education Committee, and within the Education Committee is where the Trainee Advisory Committee actually sits. And the Trainee Advisory Committee is responsible for connecting with the Campus Representative Program and helping to increase that network. Next slide. So the next thing I want to say is the TAC versus the campus rep program. Essentially, they're two distinct programs. So being a member of TAC doesn't necessarily mean that you're a member of CRP, and the same goes vice versa. You can, if you want to, choose to apply to both and potentially even serve in both. It's up to you. You just have to really think about your time and whether or not you have the ability to commit to that. And also just a caveat, if you do apply to TAC and for whatever reason are not accepted, you will automatically be offered a chance to be a part of the CRP. Next slide. So on this next slide, is this just a head-to-head description? Like I said, a lot of these points were already discussed within the webinar previously, but it's just for you to have this on one slide to be able to make decisions about which programs you might actually want to be a part of. And I just want to make one particular notation, is that a faculty member can also be a part of the campus rep program. So it's not just students, it's students, trainees, and faculty. Whereas TAC is CUGH students members only. So like I said, this is all just a review of what we discussed already. And if you have any more questions about it, feel free to ask us at the end of this webinar. Next slide. So finally here, this is just our contact information and where you can find us on various social media platforms. In case you have any questions, like for example, if we don't get to your question in today's Q&A session, or if maybe you think of the question after the webinar is over, this still provides you with an opportunity to reach out to us. And plus these slides will be made available on the CUGH website after this webinar is done. So at this time, I'd like to pass it on to Dr. Kilmarks from the Fogarty International Center, who's going to talk about opportunities there.
Terrific. Thank you, Priscilla. And I really want to thank you and Keith for this opportunity to talk about the Fogarty International Center. I'm Peter Kilmarks. I'm the Deputy Director at Fogarty. And training and capacity building is such a big part of our mission. It's really wonderful to have this opportunity to speak to this group. So I'll just take a few minutes. Okay, so the NIH, the US National Institutes of Health, is actually the biggest funder of global health research and of biomedical research worldwide. The budget is about $40 billion, and there's over 20,000 employees. There's 27 different institutes and centers. Some of these will be, you'll recognize the National Cancer Institute, the National Institute of Allergy and Infectious Diseases, led by Dr. Tony Fauci. But there's really for all disease systems, organ systems, different institutes. And we're at the Fogarty International Center are supporting the global research work of all of the NIH. So our mission at Fogarty is, again, to support all of the global health work by NIH, which is quite extensive. And then in addition, with our own resources, we focus on training and capacity building for the next generation of global health researchers, and especially in low and middle income countries. Just a schematic of how we work with our collaborators, the kind of human research capacity pipeline. We have in low and middle income countries training programs we've had for decades. Their D43 is the funding mechanism, but in HIV/AIDS and other infectious diseases and non-communicable diseases, this is offering short-term and long-term training in low and middle income countries. And then this Fogarty Global Health Fellows and Scholars Program has opportunities for both US and LMIC trainees. I'll say a bit more about that on the next slide. And also these fellowships for postdocs, either for US or LMIC postdocs. And then as people begin their research career, we do have from Fogarty some small grant programs, so-called R21 grants, but generally researchers move on to the other institutes. We do not have the NIH R01 grant from Fogarty. So generally our trainees and people we support move on to in their research career to getting support from the other NIH institutes and centers. This is a picture of our director, Dr. Roger Glass, who sends his greetings. And just to quickly say a bit more about these individual training opportunities, I mentioned the Global Health Fellows and Scholars Program. This is to provide a year of support working in low and middle income countries, and it's for both US and LMIC trainees. These slides will be shared, and those are hyperlinks that you can click to learn more about them. And then the second and third here are the so-called K Awards. The URSTA, the K01 is for 5 years of support for US postdoc scientists. And then the K43, the Emerging Global Leader Award, this is also 5 years of mentored support and protected research time for LMIC postdocs. Here we go. And I just want to highlight one of our trainees, Evelyn Shea. She was a Fogarty Scholar working in Peru on STDs back in 2004 to 2005. And then later she was a Fogarty Fellow, and so was supported to work on osteoporosis and breast cancer in China as a Fogarty Fellow. And now she's just finishing up the K01 award, the URSTA support. So she's been working with Fogarty support in China on osteoporosis and HIV. So just to give you a picture of how someone can get this support at the beginning of their career. And I also wanted to mention, so this is not from Fogarty, this is from the NIH Intramural Research Program. There is a summer internship program at NIH to work at the NIH Clinical Center. There's over 1,000 interns every summer. It's been a little bit different this summer. But the applications will open up in the fall for next summer. And this is for 8 weeks, at least 8 weeks to be on campus at the NIH. It's open to US citizens and to permanent residents. So if someone's interested in this, I would encourage early application. It's kind of a rolling admissions process and a competitive process. So want to just encourage folks that are interested in global health research to connect with us, to subscribe to our newsletters. You can follow us on Twitter, follow us on Facebook, and just hope that many of you will have an interest in a global health research career and that we can work with you and support you. Lastly, I just wanted to mention the CUGH Research Committee. I'm the co-chair together with Judy Wasserheit from the University of Washington. And we have our TAC members, Melissa Som, Ryan Hodgman, and Sarah Matthews, who's just spoken, and really value the input from the TAC members. And we've got some upcoming activities, including we're planning an abstract advisor program. So hope to be able to interact with many of you, and would encourage you, if you're join the TAC, to also think about working with us on the research committee. So I will end there, and I think hand things over to Keith for the Q&A. Thank you.
Wonderful. Thank you very much, Peter. Thank you, Priscilla, Deepika, Sarah, and Sebastian. Those are wonderful presentations. So we're going to get right into the questions. We've got quite a number of questions. I would encourage all of those who are online right now to please send in your questions, and you can do so online, and we'll get to as many of them as possible. Priscilla, could you share a little bit more, and I'd like to ask Sarah the same question, about the advocacy component of both the TAC and the campus reps, and maybe use the gun control tracker as an example of how you're using students to engage not only with faculty and students, but importantly the public, to, in this case, to reduce gun violence in the US. Do you want to go ahead, Priscilla, and then Sarah after that?
Sure. Thank you, Dr. Martin. So I'll definitely start with the gun control. So essentially what we do in TAC is we kind of find out what issues are, we work with CUGH to find out what issues are prevailing in different countries or in the US, and then we try to find different ways to help bring light to those issues or to help people keep informed about those issues. And so for this gun control tracker, the CUGH Secretariat was very helpful in the development of this process, where you can now actually see a way to know who is actually where they stand, the U.S. congressman on gun control. And this is an example of how we try and work on advocacy issues. Another issue that came up was underrepresented minorities in postgraduate education. And so it started off as, okay, we have this issue, what could we do to bring light to this issue? And so then we met with not just students in TAC, but we actually brought students from outside of TAC and had meetings, and we did research, and then we wrote papers. And so it really always starts with thinking about what the prevailing issues that were currently going on in either the US or in the world, in different countries, and then trying to find ways to act on it.
Thanks, Priscilla. Sarah, did you want to add anything from the campus rep's perspective?
Sure, yeah. Since the campus representative role is a little bit different in TAC, so I would say in terms of advocacy, there's two routes that we really approach with the campus representative program. The first is that we use the campus representative to collect some advocacy issues that are really important to students, as we talked about with one of our volunteer projects right now that campus representatives are working on. Since we have such a diverse, and we're looking to increase that diversity in our program, we are collecting this information from all the campus representatives and have the opportunity to speak within this whole network to gather that information. Then since you're the representative on your campus, we expect them to advocate for these issues on their campus. I think it really represents a really broad reach, and we like to use this program to ensure that CUGH advocacy issues are transmitted at every institution, while also they're collecting that information to make sure that we are addressing student needs and interests.
Thank you very much, Sarah. And I think that's a nice lead off for this question to Deepika and Sebastian. And it's the issue that you've all brought up on affordability and debt for students. Can you share with us a little bit, the audience, a little bit about what you're doing in terms of advocacy? You've brought together, you're creating white papers, and you're using that with us to engage Congress, but importantly, the public, you're informing the public. Can you share with us a little bit about what you're doing in those areas and how are you doing it? Deepika, over to you.
Thanks, Dr. Martin. So like you had mentioned, with the white paper project and some of the other advocacy projects that we have, in order to engage the public, there are a couple different routes that we are taking. One is through social media. So we have a lot of social media accounts. We are constantly sharing articles, sharing projects that we are working on, as well as projects that the CUGH are working on, so we can further engage students and bring awareness to these topics. And then with the white paper projects, I think just doing the research, engaging students outside of TAC and of campus representatives really helps to shed light on the advocacy issues that we're working on. And then I think the future goal of presenting these papers and these projects at the annual CUGH conference, I think will further expand our outreach to the members, to the participants of the conference as well.
Thanks, Deepika. Sebastian?
Yeah, and I think just to add to that, I think that's why campus reps are so important. Just because they are, like Sarah said, the eyes and ears, and campuses are such a fertile ground for advocacy and for just spreading factual information. So I think with the White Pages project, just getting that information to campus reps, they can just do so much with it, just spread the information, advocate. And so I just think there's so many ways they could help.
Thank you. Thanks, Sebastian. So this question is for Dr. Kilmarks. Dr. Kilmarks, Deborah wants to know, she makes the good point that global health has been very Western-centric. Can you share with the audience what Fogarty is doing, and you alluded to it, about capacity building and opportunities for trainees and LMICs? You mentioned some of that in your talk. Is there anything else you'd like to add to that?
Yes, certainly. Thanks, Keith, and thanks for the question. So most of our resources from Fogarty are going to the training and capacity building in the lower and middle income countries. And we've had long relationships with many centers of excellence and truly world leaders in global health and global health research. So we're very proud of having that role and that function at Fogarty. Fogarty's over 50 years old, but we really got more into the training in lower and middle income countries at the advent of the AIDS epidemic in the 1980s. And again, some of our trainees are really some of the world leaders, including now in the COVID-19 epidemic. Some of the leaders in Peru and South Africa and Uganda and China at the WHO are former Fogarty trainees. So from Fogarty, we really take that as our main role. I mentioned some of the opportunities we have for US trainees, but the majority of our resources actually do go to the LMIC trainees and early career scientists. And again, we also work with the rest of NIH. We have the most co-funding from other institutes of any of the NIH institutes and centers. And so we really provide a bridge for the other institutes to work internationally, especially in the lower resource settings.
Wonderful. Thank you very much. Thanks, Peter. And there are multiple questions about access to the slides. So just to reiterate, that the slides will be available on CUGH's website at cugh.org. So this question is from Sharon, and Sharon wants to know the topic of postgraduate job hunting. Is this of interest to the TAC and Campus Rep program? And if it is, how might you want to address it? Priscilla, over to you, and then we'll go to Sarah.
I think that, thank you, Dr. Martin. I think that is an excellent question. And I think the research project that we are currently working on, one of the issues that we're talking about is barriers to students or trainees actually being able to actually get involved in global health. And I think being able to find that postgraduate career is an example of that. And in addition, I didn't mention this before, but we're also been working with one of the committees in CUGH, the workforce subcommittee, and one of their goals is to look into students and trainees being able to get into the global health workforce. So we're actually working closely with them as well on these projects. And hopefully this is something that we can actually look into as well. I don't know if we specifically asked about a question about particularly getting a job, but I definitely think that that's something that we can look at as well. But I think either doing a survey to seeing what students, what issues people are having with getting those jobs, talking with the workforce subcommittee as well to see what they have been finding in the research that they have done, because they have done some excellent employee research studies on this issue of global health workforce. So I think those are two different ways that we can look into this.
Thank you, Priscilla. And I would put it, so Dr. Sharon Rudy has actually done some excellent work on the skill sets that new graduates need by herself at the Public Health Institute, but also share that with us. And I would just encourage everybody to look for Dr. Sharon Rudy, R-U-D-Y's work in this area. The next question I'd like to just ask, and it'll go, Sarah, to you. Can you share with the audience some of the social media platforms that are available right now from the TAC and Campus Reps programs?
Of course. So our primary method that we use to communicate with the campus representatives is we have our campus representative email listserv. So once you join, you'll be added to this. Additionally, the campus representative program specifically uses the communications platform Slack to facilitate dynamic and intercommunicative conversations. So those are two things that are pertinent to the campus representative program. In general, the TAC social media committee actually has just opened an Instagram account. And so I encourage everyone to go follow that. I believe it's on our slides. And additionally, we have a Twitter account and a Facebook account. So we encourage everyone to go ahead and follow these accounts to keep up to date with CUGH TAC and campus representative program activities.
Great, thank you very much, Sarah. Sebastian, this question comes from Samantha, and Samantha is sending a question from Panama City, Panama. Can you share with Samantha some of the projects and programs she could do as a grad student in 2021 from Panama? How can she get involved in some of our global health work?
Yeah, that's a great question, Samantha. So currently the project that we're focusing a lot on is the advocacy project. Obviously, being in the US, there's different advocacy issues than being in Panama City. So we are trying to reach out to campus reps, different institutions to find out their own particular advocacy issue interests. And we're doing that through a survey. We have a handful of campus reps currently working with us to implement that survey and to build it and to disseminate it. So the best way, I guess, to answer your question would be to respond to that survey and let us know your interests. Obviously, they'll be different than somebody from a different place around the world. And we'd love to just build an advocacy issue out of those same interests. There's plenty of advocacy topics that we're currently working on, but if there are some that you're interested in, letting us know what those advocacy issues are through the survey would probably be the best way to tackle advocacy issues you're interested in.
Great, thank you very much, Sebastian. I'd like to Dr. Kilmarks, you mentioned briefly about a very exciting project that you started with Dr. Wasserheit, and it was your idea. Can you share a little bit more about the mentorship program for posters that the research committee is going to start for our conference next year? I should say, everybody, that CUGH 2021 is going to be virtual, so stay tuned for CUGH2021.org for how anybody can join the conference and be a part of it. So, Peter, do you want to share a little bit about this very exciting initiative that you started?
Absolutely. Thanks, Keith, for the opportunity. So this is a chance for the mid and more senior career researchers to connect with trainees and early career folks through their abstracts for CUGH. So the way it will work is when someone's preparing an abstract, someone who's a trainee or an early career researcher preparing an abstract, they can ask for one of the more senior researchers for assistance to help with just reviewing their abstract and any kind of edits or comments that they want to make. So we'll have a way for them to match up together before the abstract deadline, and to have just a brief exchange and to try to beef up the abstract and make it a stronger abstract to be accepted for the CUGH meeting. And we see this as a way, it's sometimes hard for someone who's later in their career to devote a lot of time to someone who may be at a different institution or in a different country, but this is just a nice way to have a focused interaction and to try to help improve the science and the abstracts for CUGH.
Wonderful. Thank you very much, Dr. Kilmarks. Deepika, there's still a lot of questions coming in about who's eligible to apply to be a member of the TAC and who's eligible to be a member of the campus representative programs. Could you just share once again who's eligible and how they can join?
Definitely. So like we mentioned in our slides, for TAC specifically, we are accepting all students. And like Priscilla had mentioned, you are able to be a student for 1 year and a trainee for your second year, because you'd be committing 2 full years of membership, but you would need to be a student for at least 1 year. So if you don't anticipate graduating within the year that you would serve as a member, so that would be starting in March of 2021, if you'll be a student for at least 1 year starting then you're eligible to apply. And like we were saying, it can literally be any academic background that you're coming from, any major, any field of study that you're coming from, as long as you have that passion for global health and the commitment to becoming involved within this network, we encourage you to apply. And then in order for, and then with the logistics of actually applying, we'll be sending out the link shortly. The application opens August 17th. So that will be linked on all of our social media accounts, and I believe we'll be sending that out on email listserv as well. And that will send you directly to the application. You'll have a month to fill it out, and you'll hear back shortly afterwards. So you'll know by this fall whether or not you're a member. And then Sebastian or Sarah, I don't know if you want to speak more towards the specific requirements of campus rep.
Yeah, so campus reps, oh, go for it, Sarah.
Sure, sorry about that. And so I guess we can go over the requirements for campus representatives. We require, if you are a student or trainee applying into the program, we would like that you are a student or trainee for the next upcoming year. And again, we are flexible on your end date. So given our recruitment cycle is August through July, if you graduate in May, we will allow you to continue in the program through July. However, the requirement is just for the next year. So if you're only going to be a trainee or student for the next year, the campus representative is a great program for you to get involved with CUGH. And so that would be a great option for you. If you're a faculty member, that does not apply unless we would require that you are at your institution for the next year. So that opportunity is more pertinent to you. Additionally, our responsibilities and requirements are different. And so those are outlined very clearly on the slides. I won't go as much into detail. And we offer that you don't have to be the only person at your institution, but we really would like to encourage, and we do require that you collaborate with the other campus representatives at your institution if that is applicable. You do not need to be a member of CUGH, your institution does not need to be a member of CUGH to be in the campus representative program. So that is a little bit of the distinction between the two.
Wonderful. Thank you very much, Deepika. And with the top of the hour, and I just would like to, before I thank our speakers, I just want to draw attention to CUGH. We just released Global Health Votes. Global Health Votes is really a request for all of our members, all global health practitioners, health workers around in the United States, at least, because we're coming up to an election in November, to encourage people to vote and to vote yourself. It's really important that we get every member of the public to vote in favor of their interests and exercise their democratic right, and oppose the voter suppression activities that have been taking place for a while. And we encourage our colleagues around the world to do their best to encourage their citizens to vote also, so we can strengthen the public institutions and public activities that gird good health outcomes. I'd like to, on behalf of CUGH, thank Priscilla and Deepika, Sarah and Sebastian and Dr. Kilmarks for speaking today. This webinar will be on CUGH's website, where you can find a lot of things to get involved in through CUGH, and we hope you do. So thank you for joining today, and we look forward to seeing you next time on our CUGH webinar series. And I'd like to finally thank Jenna Smith, who produces these webinars and does a spectacular job of doing that. So thank you, everybody. We look forward to seeing you next time on our CUGH webinar series.